Hello, I am Dr. Sagar Javle speaking. I am the inventor of transcranial electrical stimulation therapy for various brain conditions, for which I received a patent from the government of India last year, and that patent will be valid for 20 years. So for 20 years buying this device or selling or using from someone else will be illegal. So in this video we will discuss about the role of this transcranial electrical stimulation therapy in bipolar disorders, a psychological condition. Please subscribe this channel, press the bell icon button and make this video viral to all these patients having this particular condition. So first of all, what is this therapy and its device and its operational details? Video has been already made in extensive detail and the link is there submitted in the description box below. You should see that first and then see this video about its role in bipolar disorders. So in bipolar disorders, what happens is that the psychic apparatus or the emotional center of the brain, which is the amygdala and hippocampus on left as well as the right, they have an imbalance and they have incoordination in between. So because of that, what happens is that the focus shifts to either of them and both do not remain in balance. So generally in healthy people, the both are balanced to each other, they talk to each other and they coordinate to each other and they work in synchrony, whereas in this condition that is broken, the synchrony is broken, they have kind of become isolated, two different individuals who do not bother about each other, rather they fight with each other. That creates a chaos. So your right amygdala is the center for negative emotions. When that gets hyperactive, the person experiences depression. And the left amygdala is the center for your positive emotions and euphoria. When that gets active, the person experiences mania. So mania means the person is starts wearing colorful clothes, starts dancing, then drinks alcohol, spends money like anything, does shopping. And opposite is depression, where the person simply sits at home, does nothing, can have suicidal tendency, can commit suicide also. So we jokingly say that patients with depression commit suicide and patients of mania don't commit suicide, but their relatives commit suicide because of them. So this is a very complex disorder and it keeps shifting between each other. So it shifts to side of mania, then it can shift to side of depression. There is no guarantee, it keeps shifting. So this is called maniac depressive psychosis. Now there is a drug treatment for that. I am not against it, it's FDA approved. I have nothing against it, but it has limitations. First of all, any drug therapy, the brain wants to block it because it is coming from outside. Brain does not forgive the world's strongest psychoactive substance like cocaine, which is million times, 10 lakh times more powerful than the psychiatric drugs. This kind of brain, you think it is going to forgive this kind of lithium carbonate and these drugs which are used in this kind of disorders? No. So the brain knows that this stuff is coming from outside, the brain says no to that. So this is a very basic fact, there is nothing to feel bad about it. So brain wants to produce its own stuff, and for anything coming from outside gets very angry, it doesn't want it. So in this therapy, what happens, we are using electrical current. So the brain is an electrical organ, so brain cannot develop resistance to electricity. So this is the loophole, this is the weak point of the brain we are utilizing. That's why this therapy is going to be far more effective than the so-called drug therapy. But I am not telling you to abandon the drug therapy. You should consult your psychiatrist, take the psychiatrist into faith and consultation, and then use the therapy, because the therapy is being used with success for these conditions. This is the new device and a more advanced thing which that's all I have done. So it's not that it was never used for this. It was used for maniac depressive psychosis. So what are the specific spots, what are the specific frequency and duration to be used in this particular condition called as maniac depressive psychosis? So if you have to modulate the amygdala, it's a structure which is very deeply situated, at least 7 to 8 centimeters from here. So in previous days, the electrodes had to be put by creating boreholes. So that is an invasive, very risky procedure. But the good news is that the amygdala and hippocampus, although they are deeply situated, but they are under the control of the temporal lobes. These are your temporal lobes. They are around the ear, just in front, over and behind the ear. This area is the temporal lobe. So each temporal lobe has a direct connection and control over that side amygdala and hippocampus. Now the temporal lobes are superficially located. Now that's why this therapy can work, because now what we are going to do is we are going to modulate the temporal lobes, not amygdala and hippocampus. Because as I said, that amygdala and hippocampus is deeply situated, so the current cannot pass so deep. Current can pass only up to 1 centimeter, maybe 1 or 2 centimeters, and the temporal lobes very much gets activated or involved with this particular therapy. But the temporal lobes are directly connected to amygdala and hippocampus. That is how they also come under control. So what we are going to do is take a head strap which is provided, wear it like this. On this black surface, put ECG gel, cover, massage it all over the place. Otherwise, only area of the gel will get stimulated. Okay. So both the electrodes ready, and this is the location just above the ear on the temporal lobes under the head strap. This is the location where you should put the electrodes under the head strap and start working on it for the condition called bipolar disorder. Now what is the duration? Start with 30 minutes, then 40, 50, 60, up to 90 minutes you can go. Then once a day or twice a day you can do, depending on the severity of your condition. Then what intensity to use? Intensity should not be more than 5. Some people have burning pain at 5 itself, so reduce it to 4 or 3. So 3 to 5 should be the intensity. Machine can go up to 40, which would be very high. You will get a big burning there, although no injury, but very bad pain and a very unpleasant sensation. So start from 1, 2, 3, 4, 5 till you bear it. So you can bear 5, no problem. If 5 is burning, reduce it to 4. Don't use too less like 1, because then it will not work at all. So I think it's 3 to 5. That's all, the intensity. Then the frequency is very important. Now for the synchronization of the brain, which is very important, the frequency based is alpha. So 10 cycles per second should be the frequency. So you should stimulate with 10 cycles only in bipolar disorders. What will happen? Both your amygdala, hippocampus and the temporal lobes will get synchronized with one another. Okay, and then once you have synchronized for a few sessions, you can reduce the frequency to two cycles per second. Why? Because we don't want depression also, we don't want mania also. So we want to calm down your centers both. It is like Sri Ram. One of the qualities of Sri Rama is what? Sthita pragya. The Sanskrit word Sthita pragya means indifferent. And one who does not get excited also in positive times, and one who does not go into depression also in the negative times. So not involved, not moved with either depression or with mania. Mania we can say positive cycle, and depression negative cycle. So one who remains indifferent. So we want to synchronize your brain hemisphere first, and then we want to calm down your both the amygdalas and hippocampus. So we will calm down. We are not going to stimulate. If I stimulate, what will happen? The intensity of your bipolar disorder will increase. So start with 10 cycles only. Never go above that, otherwise it will stimulate both, again problem. Start with 10 cycle, then 8, 6. Now this machine has the lowest of 2 cycles per second. So 2 is the last. So after few sessions you stay to 2 cycles per second and calm down both amygdala and hippocampus, so that neither you go into depression nor you go into mania. Because the more intense is the mania, the more intense will be the depression also. It's like duality, what they talk in spirituality. So we don't want both. So we'll just calm down and nullify them, and plus synchronize them. So when they start talking to each other and the connection is there, there is actually an imbalance between positive and negative. Actually, the negative emotions are also necessary. God has given us not for fun. Otherwise, you will jump from a building, you will jump from the aeroplane and die. So negative is also important. It has become excessive. That is the problem. So a fine balance will come, and plus we will calm down both, make you like Sri Ram, Sthita Pragya. So that is the idea. So from 10 cycles go to 2 cycles. Intensity is not more than 3 to 5. Duration of 30 minutes go to 90 minutes max, once a day, maybe twice a day, for 3 months. And then a maintenance of once or twice a week could be for the rest of your life, because we don't know these conditions. I don't know, when you stop doing, there may be a recurrence. I don't know. So that much studies have not been done. So if you are feeling so good and free of everything, why not take for the rest of the life, once or twice a week? Initially daily, then once and twice a week for the rest of the life. So I think we have discussed intensively about this condition in this video. In the description box below, there are links to my website, my personal number and email and everything, and on the website, on the order page, you can buy the device and send the video to all these patients of this particular condition. And I think that is enough. Thank you very much.